It. Okay. So basically, we wanted to speak. We would like to speak to you basically to share our desires. We'll stand. We're not going to stay long. We just want to you to understand how important it is that when Trump gets into office, that he does not mess with the Affordable Care Act. And so Ms. Kriegel and him are going to speak on, personal reasons as to why this is important that you relay that this actually, here it is. He's going to read it. Do you have a copy here? Will you give him yours?
Yeah. Yeah. Can I keep it or you want to confirm?
Yeah, you can keep it basically.
Yeah, I'll get you a business card. You want a bunch or just one?
Yeah.
Bunch. Okay. Anyway.
Yeah, and so we basically want you to understand because by Senator Corker, being a Republican and, we understand that there's now a majority. We want you to understand that it's important that this is not only going to affect Republicans and Democrats, it's going to affect everybody. So basically, Ms. Kriegel would like to speak to you. So, Ms. Kriegel?
Go ahead.
You're on what?
I want Obamacare.
You are?
Yeah.
Oh, so really?
You got benefits?
I mean, it's by law. Senate staff has to be on it.
Yeah.
Except, they...
Did not really?
Yeah. So Senator
for you?
Corker's on it.
How's it working?
Yeah, it's been fine so far. I mean, I haven't had any major injuries, but,
Right. Okay.
typical trip to the pharmacist or whatever. But,
Right.
Okay, so
And I had
Ms.
strep throat in May. Who gets strep throat? That's
It's
like
good.
over like 10.
My
You know?
son every year,
Really?
report.
Oh, it was terrible. It was like the worst thing ever, but they took care of me. So, anyway, sorry. Enough about me.
Okay. Ms. Kriegel?
Go ahead.
Again, thanks for seeing us.
Sure.
Virtually every day that I go to work, I deal with people who've lost their jobs. I'm an employment lawyer, and I represent employees. And what is most frightening and most terrifying is the loss of employer-covered health care. And so many have discovered that that fear can be allayed and addressed so that they could focus on getting new employment thanks to the availability of health insurance under the Affordable Care Act. There are some who have even called me and said, well, if you can't get me my job back, at least you sent me to the right place to get employer.
I'm an attorney as well.
Okay.
I practice immigration law.
Great.
And I am not the kind of guy who goes out and participates in demonstrations, but I've just felt compelled to do so since the election and the rhetoric that is involved in the election. I think I'm 68 years old. I'm on Medicare, and there are many people like me who are getting older and who know that their incomes are going to be limited as they reach retirement age, and we're scared to death that Trump and the Republicans are going to take away or reduce our health care. And this is something that has been around for many years, Medicare and Medicaid. It's a very important aspect of common people's lives. We plan on it for our retirement, and if you take it away or reduce it, it's going to have a huge impact upon people. And Obamacare is something that people have been talking about since the Truman administration, and we finally got it. And it's so important for the working poor, people who are working hard 40 hours a week but can't afford health care, or who can't get health care because of pre-existing conditions. And this has been a breath of fresh air for us. And now that we have it, we don't want to lose it. And many people need it. And we're scared to death that Mr. Trump, and I know Senator Corker has a close relationship with Mr. Trump. I've read the papers, and I know that he's had meetings with Mr. Trump. And I just hope that we can convey to you, so that you can convey to Senator Corker, our concerns about health care. We believe that every human being has the right in 2017, 2016, in the 21st century to good health care.
Yes.
And if you can't get it, when poor people or working people, middle class people, who can't get health care insurance, something's wrong with our country. And Obamacare helped to fix that. And we don't want that fix taken away. We want it improved upon. We want it expanded. And it's so important for so many people in this country. And I hope that you'll let Senator Corker know that.
Sure, absolutely.
I've lived in Memphis. I'm 68. I've lived in Memphis since I was 11 years old. So I'm a Memphian and a Tennessean, and I vote. And I'm not going to vote for someone who tries to take away health care or Obamacare.
Care, maybe the name, they're upset with the name being Obamacare. They want to come in just because of his name on it to destroy it. And what's good for the people, if it's good for the people, then that's for what we want to have. It's for all the people, not just some of the people. And it's not just one race it's covering all races. And so because it has his name on it, his stamp, we just want to take it away because of that. And I need to look at it and see if that's something that can help us. If not, something that can keep, because healthcare is going out the zoom is the price of it. People going overseas just to trying to get healthcare because of the price of it. So if we can get folks covered and keep them here in this country and love on us, if we got the money, we got the resources, so why throw something out, the baby out with the bath water because it has his name on it.
Yeah.
I was a nurse for 40 years, mostly in the public sector. My husband is employed, I'm on Medicare. My husband is employed and doesn't have insurance through his employer. He's on Obamacare. My son is disabled and he's on Medicaid. I don't want anybody putting their hands on any of that. These are, I mean, when I was working as a nurse and patients would come in or they would call me and I did intake and people would call and they didn't have insurance, it was so heartbreaking. It was so devastating. And when people got on Obamacare, it was transformative for their lives. People with chronic illnesses have a hard enough time anyway. Nobody realizes how hard people with chronic illnesses have it. When you add the anxiety of, or the reality of losing everything you have, because your child needs care or you need care or whatever, that is wrong. That is morally wrong. That is not the America that I want to live in.
The only statement I have is, if it is repealed, it needs to be replaced. It can't just be.
Can it be repealed without a replacement being in place?
Yeah, you
I mean,
can.
in theory, I mean, yes.
Pardon me?
I mean, theoretically, it could. Practically, I seriously doubt it. I don't think that's going to happen.
Yeah,
Well-
I'm concerned because they're saying they want to keep certain provisions like keeping children under age 26 under the plan, allowing people with pre-existing conditions, but without the mandate, how will that be affordable to anybody? And I feel like they're just selling us hot air.
Yeah, the insurance company
Yeah.
won't go for that. They won't.
Yeah, we just,
I
feel like we're not being told the truth. We're just being sold something that sounds good because people dislike Obamacare. And I would like some straight talk from our leaders. And I think I'm a Democrat, but I'm so willing to work with, Republicans. But
Well, there has to
show
be
us
some
something.
level of bipartisanship,
Yeah.
because if it was a pure vote, then it would be filibustered, right? I mean, you need to have some level of cooperation.
Yeah, you need 60 votes in the
Right.
Senate to
So-
repeal.
But I
But
think
you
it's
only
being
need
figured
50.
out what is going to happen.